Have you been diagnosed with a C5, C6 disc bulge? Are you struggling with relentless neck pain, arm pain, numbness, and tingling from the C5, C6 disc bulge? In this video, I will reveal a revolutionarily non-surgical solution that promotes safe, fast, and effective relief. Imagine waking up from a debilitating neck pain and arm pain caused by your C5, C6 disc bulge. What if there was a way to alleviate the numbness and tingling in your arms without undergoing surgery? That's where the Back to Life method comes in. It's a revolutionary approach to treating C5, C6 disc bulges at their root cause. And in a moment, I will outline it for you in detail. If you have tried other therapies, drugs, injections, and these methods have failed you, it's not your fault because at best, these treatments are temporary fixes that merely mask the symptoms. Unlike temporary fixes, the Back to Life method provides a long-term solution that truly heals. The treatment I'm about to show you is based on years of clinical application, and disc bulge patients have proven success. It has an 80 to 90% success rate in not just alleviating symptoms, but in promoting genuine healing and recovery. By the end of the video, you'll have a comprehensive understanding of the C5, C6 disc injury. You'll learn how a C5, C6 disc bulge causes neck pain, as well as numbness and tingling in the hands and arms. In addition, I'll provide you with a crucial checklist of things to consider when seeking professional treatment. Make sure to watch the video until the end, because missing any item on this checklist may be the reason why your C5, C6 disc condition fails to heal and becomes chronic. Hi, I'm Dr. Raminder Burke, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical spinal decompression as a cornerstone of our unique and proven Back to Life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain at home. Plus, you will discover which therapies are best for treating disc bulges, disc herniation, and other spinal degenerative conditions. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link in the pinned comment below. Now, before I explain the details of the Back to Life method for treating a C5, C6 disc bulge, let me first explain exactly what the C5, C6 bulge is and the symptoms associated. This understanding is crucial for knowing why conventional treatments might fall short and how our proven methods provide a more effective lasting solution. So what I'm going to start with is an underlying cause. What is causing this C5, C6 disc bulge? So obviously the disc is a cushion between the two vertebrae at any level of our spine, and especially this case in our neck. When these vertebrae are normal and healthy, each individually moves within this section of the bone. So basically, the vertebrae move independently. Each level has to move before the only way the disc gets fluid exchange or circulation is when these bones are working around them. So pumping action of fluid exchange occurs at the disc level at C5, C6 when these bones are working and moving. That's the only way the discs get circulation, fluid exchange. What can happen in our spine from countless causes, whether it's poor posture, whether it's injuries to the neck, whether it's injuries in car accidents, whether it's posture on the phone, whether it's posture on your computer. Each of these daily stressors can cause a shift and a misalignment in our vertebrae. In the spine, we know this as subluxation. So a subluxation in the spine is a misaligned vertebrae that has now stopped working. The working problem, not working problem is the cause. As the cause is now compressing that disc at C5, C6, it's going to start losing fluid as no fluid can come back in. So without fluid coming back in, now we're losing height around that nerve root. So that nerve is the real feelings that begin, whether they're once in a while or more often as it keeps compressing. We don't want this cause to stay like this or it's going to degenerate further. So as we get past that point, degeneration in the spine is permanent. We can't reverse it at that point. As the disc compresses further, it has nowhere to go. So the disc is breaking down and it's leaking into that nerve space. And now we're going to start getting symptoms that are associated with that. So ultimately, the bulge is going to be as things compress, they start pushing that fluid out onto that nerve root and they progress into further and further problems, feelings, and permanent. as it gets worse from there. So what are we going to feel with that? Obviously, this is the neck, correct? So when we're looking at the neck, the upper neck is going to go directly affecting the brain. It's going to pull on the spinal cord at the brainstem, we call this. So if a C1 is under stress, we're going to feel symptoms in our head, our eyes, our sinuses, our jaw, our face, tinglings, numbnesses, headaches, of course, vertigo. A combination of stressors in the head and neck can trigger so many things in the facial nerves. We call these the cranial nerves. Secondly, at the C5, C6 level, now we're looking at the symptoms that really concern most patients with this problem: shoulder pain, neck pain, down the arms, numbness, tingling, radiculopathies, all of these feelings into the elbows, the wrists, countless feelings, weaknesses, dropping things, all of this associated with C5, C6 disc bulges. So that's really the concern. We want to get to the symptoms as we've talked about the cause through the proper treatment. So what are some of the traditional methods used in helping the C5, C6 disc bulge? We're talking about physiotherapy, we're talking about acupuncture, we're talking about massage, which of course can help alleviate or reduce some of the symptoms that are associated with the C5, C6 disc bulge. Medically, we may get into medications, obviously, getting stronger and stronger pain medication, which obviously has stronger and stronger side effects. Those are my concerns, whether they're injections, muscle relaxants, or actual painkillers. And then, of course, more severe medical procedures have to happen if that medication is not working. We're looking at injections for nerve blocks, cortisone injections, which do deteriorate bone density. We're talking about actual nerve ablation, where we're actually having those medical doctors burning and killing nerve tissue, which obviously has multiple purposes, and we don't want to see the side effects of that. Surgeries for spinal disc conditions remove part of the cartilage. That actually interferes with future treatments because now we've taken tissue away that we can never put back in. Less tissue means less chance for recovery if you do eventually have that surgery fail and want to do other treatments, which may naturally correct the problem, such as the treatments we're going to get into with our Back to Life method. So I always say this is similar to if a house is on fire, who do you call? You call a fire person, you call a fireman to put out that fire. But obviously that fire being put out is temporarily, and it's not correcting and building that house back. You're going to call someone who's a professional contractor to rebuild. So we want to do that for you. We want to be the person that rebuilds the true cause of the problem instead of masking it with symptoms and using things that are only temporary. So when we get into this is the Back to Life method. So many of these patients have obviously gone for some form of study, whether it's x-rays, ultrasounds, CAT scans, MRIs. Of course, we want them to bring that with you when you come in. We'd like to have as much information as possible to give you the best treatment and recommendation, but we're always going to send you for my own x-rays. I want to see specific x-rays of your cervical spine in this case, but the full spine. We look at it as a whole. Your spine is not separate. Most patients have other related symptoms in their spine, whether it's the lower back, it mirrors the neck in many cases. So wherever the degeneration is in the neck, many times there's going to be an associated degeneration in the low back. The body has that effect. But when we look at these x-rays, we want to see if you're a candidate for this Back to Life method treatment. And how we determine that is a combination of looking at the posture on the x-ray. So ideally in a near perfect x-ray, we would see a curvature. We call this like a banana shape, a lordosis in the spine, because that's going to keep those disc spaces healthy. So at the C5, C6, normally we'd see a large gap, equal gaps throughout the spine. So that's where we want to see. But most people with this condition obviously have changes in those x-rays. What we usually tend to find is loss of curvature. Forward head posture causes a loss of curvature. What that's going to do is it's going to take this relaxed, curved, posturally healthy spine, and it's going to stretch out the ligaments in the back of the neck. The tension builds up in the spinal cord. It's going to pull on the brain. It's going to cause the weight of the head to shift forward. So as it shifts forward, the bones at the front of the spine are taking this load, which are not meant to be. So this cartilage is supposed to be part of the support in the neck, but it's mostly supposed to be the weight of the head is supposed to be on the back of the spine, on the facet joints. And that means this is the weight of a bowling ball, basically, on the back of the spine where the joints are meant to take that load. By shifting forward in the head and the weight being on the front of the spine, on the cartilage, the disc, that C5, C6 disc is now getting pressurized compressing instead of fluid exchange and movement. So when we look at these x-rays, we're going to see that in the beginning stages or already causing some of the disc bulge sensations and then degeneration and worse and worse. The more you go this way, the less we can help you reverse and completely correct the problem. As this breaks down further, the bones have to compensate. They thicken up and we call these spurs at the lower neck level. At C5, C6, a disc bulge is going to be associated with degeneration and spurring, and that leads to worsening effects down the arms and fingers, and we can't really correct it at that point, only provide relief. So this is what we look for as determining how much treatment you need, how long it's going to take. We have a realistic start point and then a program of care, and then a follow-up x-ray will be done to see the progress and changes to determine what you need into as we get into what we call maintenance care. So next we're going to go into the Back to Life method, the three-pronged, three-step main approach to correcting and reversing C5, C6 disc bulges. So the most important part of our Back to Life method is going to be the key component of correction at the cause of the problem. As we talked about earlier, it is subluxation in the spine, misaligned vertebrae have compressed the disc tissue, and that is the root problem that we have to correct. So obviously restoring alignment gently, especially when it comes to a C5, C6 disc bulge, is to restore alignment. Then and only then will those other treatments have a lasting effect. So when we talk about correction at the spine, that's the chiropractic adjustment. So when I use these techniques that I use are going to be very gentle in the beginning because we cannot force that disc back into alignment and force the vertebrae. We have to be gradual and gentle. We may use hands-on, or we have specific tools that get into the spine and just gently restore movement at that vertebral level to get that disc pumping again and get those bones restored back into alignment. Other various checkpoints can tell me which direction the vertebrae has misaligned at C5, C6, and then what we use is a very gentle drop table technique. Basically, the table comes up and I'm just going to hold gently on that vertebrae, and as we give pressure, the table is going to click back down and just realign without twisting the neck. None of those scary things that we've seen in videos and movies. This is restoring enough of exactly what we need, only where we need it. So an adjustment done accurately is not cracking and popping everything, Y straps, pulling on the spine. None of that is necessary because we want to be specific. Because you have a gentle damage already in the spine, we don't want to create more inflammation, and we don't want to be general. We want to be specifically targeting the C5, C6 because we know that's degenerating or bulging because of a bad alignment in that area. So restoring the neck and spine, and then whether we use the tools such as the rapid release, which is a vibration tool very specifically to create fluid exchange and more reducing the inflammation. That vibration targets and breaks down more of that scar tissue and inflammation, and it just enhances the adjustment. So the key component, the most important cause correction, is going to be the chiropractic adjustment in conjunction with the other parts of the Back to Life method. So the key component of the Back to Life method is this unique computerized non-surgical spinal decompression. What we have here is a computerized program. We're going to punch in exactly how many pounds based on the patient's needs and weight. Then we have specific targeting. So these are called three-dimensional decompression because I can angle the neck to target the C5, C6 disc bulge. So over a series, the table is going to pull and relax. It's going to create pumping action at that cartilage that we talked about. So as alignment's restored, lasers breaking down inflammation, the spinal decompression table is going to create that space around the nerves, help that disc bulge come back in, because the table is pulling, it's creating a vacuum effect on that cartilage and it sucks back any bulges or beyond. So as that table is restoring the disc, the fluid exchange is restored, the disc is getting gain height, and studies have shown that the decompression actually corrects the disc problem. It's not a temporary pulling or just a relaxation of the muscles. we're getting to the disc because of the programs that we have on these tables. They bypass the musculature. The muscles are pulled and relaxed, and then only then the table goes further, and that gets to the disc and bypasses muscles. The difference with this and a traction table is that the traction table pulls and just holds in one position. It's static, muscles fight, they contract around that, and you never get to the disc. And anything else at home techniques, whether it's a over-the-door traction or things of that nature, someone pulling, it just never does this. A Y-strap or a hands-on pulling is never going to do what a decompression table does. So that's the non-surgical spinal decompression, creating that permanent disc fluid exchange that we want to restore the disc with, alleviating all that stress and tension around the disc at the C5, C6 disc bulge. Key component is going to be low intensity laser therapy. This is a class 4 laser, one of the best and strongest on the market. The purpose of laser is multitude. It's going to be to break down inflammation, scar tissue, whether you've had an old injury, the tissues inside are not the same, and even healing the cartilage. So the low intensity laser feels like a warm light. We're just waving this over tissues, healing, bringing that blood flow back into that area, and breaking up scar tissue and inflammation especially. During treatment, there's inflammation created by the treatment as we're decompressing, as we're realigning. We want to flush that out so the sorenesses go away faster. The lactic acid is broken down and blood flow is restored to the disc as well as to the cartilage and the muscles around that lower C5, C6 disc bulge. So laser feels great. It feels like a warm, soothing light that heals tissues and helps the process recovery faster. It's important to remember that while treatments like physiotherapy and medications can provide some relief, they don't often fully address the underlying cause of a C5, C6 disc bulge. When you're seeking treatment, make sure the professionals you choose don't just offer quick fixes. Look for those who use the components of the Back to Life method, ensuring a thorough approach that targets the root of the problem for lasting relief. Now, I'd love to hear from you. What's been your experience with a C5, C6 disc bulge? Have you found any treatments particularly effective, or maybe something that didn't work at all? Drop a comment below and share your story. If you have found this video helpful, please give it a like and share it. Your support could help others learn how to manage and treat a C5, C6 disc bulge more effectively. Remember to subscribe to my channel now if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your neck and back pain at home. The next video you should watch is this one: 4 supplements needed to repair discs, which are beneficial for a C5, C6 disc injury. Check out the video here to learn more about these helpful supplements.